Good afternoon. I'm Jonah Cummings from the CNY Lyme and Tick-Borne Disease Alliance, and I'm excited to be here with the Onondaga County Executive, Ryan McMahon. Thank you for taking the time to speak with me today.
Thanks for having me.
So while we're hopefully at the tail end of this COVID-19 pandemic, I'm sure the last thing you want to talk about is another health crisis. But as we're moving into Lyme Awareness Month, it's time to bring attention to another major problem that we have here in Onondaga County, and that is Lyme disease. So having said that, you've had your own personal experience being bitten by a tick. Can you walk me through that?
Yeah, no. So it was actually, it's a scary experience. So essentially, I was doing a lot of work on this issue from the legislature. We worked on creating essentially culling and management programs for tick specifically, but also deer. And as we were going through these, I became very familiar with the risks and the necessary things we need to do as a county to stay ahead of this. And I had a situation where on the back of my thigh, um, think about where your hamstring is. One day I was just in the shower and I was itching at it, and I didn't think anything of it. I thought maybe I had like a little skin tag or something. But then, a couple of days later, it was still there. And then the next day I just ripped at it and it wasn't a skin tag, it was a tick. So, I was nervous. It was at least 3 or 4 days where it was there, and I was very concerned. And I actually went to Dr. Gupta and Dr. Kwok on our team, and they were able to help get me a prescription to try to address it to prevent the infection from taking place.
And we know the city has implemented a deer culling program. They've also been doing this in Manlius, Fayetteville, and DeWitt. Can you bring us up to speed on the countywide efforts to control the deer population?
Yeah, so we see certainly when you think about city neighborhoods that extend into the inner ring suburbs, so your outer ring city neighborhoods, inner ring city suburbs, we see challenges there. In Fayetteville, we funded a program for many years now, and so where you have kind of this area where there's flush habitat. And where the deer do very well, we've had challenges. So in the town of Onondaga, east side of the city of Syracuse, west side of the city of Syracuse, parts of Camillus. And so what we did is we've developed a funding mechanism. Really, to have a successful program, the local community needs to be the leaders, because if it's going to have wherewithal, they need to be invested. And there's no one county-wide tick or deer culling management strategy that will work, because each neighborhood's challenges are different. So what we've done is we've funded the city plan, we've funded Fayetteville's, we've funded parts of DeWitt's, I think Camillus has a plan as well, and we continue to encourage communities that are seeing this challenge to do this. And then we provide some of the technical resources with our partnership with Cornell Cooperative and our own environmental team, and then we supply the funding as well. Typically these programs could cost anywhere from $15,000 to $50,000 a year.
And beyond just controlling the deer population, how can we better educate and protect the people who are visiting our county parks or even just mowing their own lawn?
Yeah, I think really, especially for homeowners and kids, the reality is that these, if you're out and about and outdoors, you really should check yourself when you come back in, especially when mowing your own lawn, and wearing pants if you can. And these are all things that I've done in practice since I had, my episode. But it's just got to be part of life. And again, especially with your kids and your animals and your pets. From the county park system, we maintain our parks pretty well. But again, you're talking about wooded areas where we do have habitat, and there will be ticks in some of these areas, right? So if you're in a park, please stay in the trails the best of your ability. But again, check yourselves for ticks when you're done enjoying our park system as well.
And you and your county health department have done an awesome job at managing your COVID response. And so do you think your health commissioner has the resources she needs to both handle what's left of this COVID pandemic while staying on top of this other epidemic that is Lyme disease?
Yeah, we do. And again, you have the medical infrastructure in our community is very robust and strong. We're very lucky that we have the talent we have. When you think about just the amount of primary care providers, but also the three main hospitals, and then the public health side of it, where certainly over the last year, the public's gotten to know what we do and how well we do it. So resources are always a challenge. Certainly, we're in a better position fiscally today than we were a year ago. And this is an issue that we've been following very closely. So I do believe we have the resources we need. That doesn't mean that there won't be more innovation and more best practices that we'll learn about in the future that will require funding. We welcome those.
Well, thank you so much for all you've done to keep our county updated and safe, and all you're going to continue to do that. But thank you so much for joining me today. I really appreciate it.
Yeah, thanks for having me.